go ahead and get started, and then hopefully a few more people will trickle in as we start talking. But hello, everyone, and welcome to our RTAP bi-monthly webinar series. Thank you all for joining us today. My name is Beth, and I'm a GRA here at Kansas RTAP. Please feel free to add your names and your agencies in the chat box. We can all get acquainted. In the meantime, I will just go over some housekeeping rules before introducing the speakers. Please remember to keep yourself muted during the duration of the presentation, as there will be a Q&A session at the end. But if you do have any questions during the presentation, please put them in the chat box so we can address them later on. I'll also be adding my email in the chat box in case you run into any technical difficulties. So feel free to reach out with any other concerns as well. So today we have two Kansas mobility managers joining us for this roundtable today. Michael Wilson serves as the Director of Mobility Management for the Flint Hills region of Kansas, bringing extensive experience into public transit since 2018. Passionate about helping others, Michael actively contributes to social services and food systems, fostering community, well-being, and accessibility. He thrives on finding creative ways to make transit inclusive for everyone, ensuring that transportation systems meet the diverse needs of the community. With expertise in travel training, advanced technologies, GTFS, real-time systems, camera systems, and software solutions, Michael combines innovation and collaboration to develop reliable and people-centered mobility solutions. Dre Vell started their professional career with a brief role as a land use planner, where they gained valuable insights into the relationship between urban development and infrastructure. This experience sparked their interest in the interconnectedness of land use and transportation systems. Now thriving in a career in public transportation planning and mobility management, Dre Vell focuses on creating accessible, sustainable, and efficient transit solutions. By leveraging their foundational knowledge in land use planning, they excel at developing integrated strategies that enhance connectivity and improve the daily lives of the communities they serve. And with that, I'll hand it over to Michael and Dre Vell.
All right, let me get the screen shared real fast. Let's see that.
Thank you for that introduction, Beth. And welcome, everyone. I'll get us started today. My name is Mike Wilson, mobility manager for the Flint Hills region. I've been doing this for 6.5 years. So we're going to just kind of go over what mobility management is and some of the projects that we've done that we're working on, and then we'll have a Q&A at the end there. Okay, sorry, just clicking off, clicking that chat there. So first, I just want to start off. What is mobility management? As transit managers, have you ever just been too many meetings to go to? Just maybe needed someone to help with outreach, potentially needed that individual to help with marketing. Maybe you don't have time to build a website. Um, have you ever just wanted that extra employee in your region who could help with grant writing, a lot of different things? So that's kind of what I think a mobility management manager is. We're that extra person. Each region has a different need, and we're here to fill that gap. Transportation problem solvers. Like I said, we identify and address transportation challenges. That community connector, we connect public transportation with different social service agencies, local governments, businesses. We are planners and innovators, and most of all, we advocate for accessibility. Mike's coming in too. People are starting to roll in. That's good. Next slide, Dre.
Too many screens.
Yeah, and then I'm like, are we bringing these? I'm like, should we wait for them to all be admitted? So mobility management, KDOT is a KDOT. Now Mike's coming in. We should have Mike speak on this. This was a program that came out of KDOT. We have our state mobility management goals here. This from KDOT is to identify potential barriers and gaps in service and increase coordination among transportation agencies to address the needs. Work with our CTDs to further local priorities, increase efficiencies in transportation services. And those local priorities are determined by the CTD. To build partnerships in collaboration with health and human service agencies to leverage resources, improve mobility options, and increase access for all segments of the general public. We also are here to foster education and increase awareness of public transportation. Next slide.
So the way that this mobility management program kind of works on the back end is KDOT has a pool of money set aside for 10 mobility managers across the state, and they will work with their coordinated transit districts, which we'll get into soon, and one of those agencies within that region, not necessarily a transportation agency, will offer to be the host agency or the fiscal agent for the mobility manager. And so, they're the agency that's offering the employee benefits, paying your salary and wages, and managing the money. And then KDOT reimburses them for all of those costs. We do have to submit reports every year. So there is an annual report that gets sent to KDOT and our CTD, which is that coordinated transit district. And then, Kansas is mostly rural, but there are some urban areas, which I'm an urban mobility manager here in Lawrence Douglas County. So my roles and responsibilities differ from the other mobility managers in the more rural parts of the state. But the budget for a mobility manager is capped at $115,000. And so that is how much money that can go towards salary, benefits, marketing, travel, etc. And KDOT will reimburse that up to 100%, with some minor caveats in there. This is our coordinated transit district map. So there are 10 districts, and there are currently 7 of us mobility managers. So we're doing pretty good for ourselves. Michelle, who was supposed to be here with us today, is the mobility manager in CTD 7, where that yellow star is at. Mike Wilson on the call. He's that light green star in the Flint Hills region. Mike Spatafor, who's also on the call, and I share CTD number 1, which are those 2 red stars. Jessica Warren has the entire South Central area, and then Misty Williams is East Central, and then Robin Jones has that Northeast corner. And what we do, Mike?
Sure. What we do is different for each of us, and it depends. Each coordinated transit district is different. Each of us mobility managers are different. Each of our host agencies and the agencies that we work with, the transit agencies, they all have a different way of operating. And then the regional goals are different. Regional goals in the southwest part of Kansas are not necessarily the same goals that would be appropriate for the northeast part of Kansas. No 2 days are ever the same. It's not the kind of job that you can walk in and be like, well, from 8 to 12, I'm doing X. And then from 12 until 5, I'm doing Y. That's not our day. Things come in, we have projects that we work on, requests come in from transit agencies and our CTDs. We do travel trainings, we do research, we find funding for projects that fit into our goals as established by KDOT. Every day is different. Conferences, we're always going to something, and then bringing that knowledge back to our region. So yeah, it's not cut and dry. It's actually quite varied, and it's usually quite interesting that way.
I would definitely have to agree on that. We tend to wear numerous hats that get us involved in all kinds of scenarios. Wilson?
Yep. So, just continuing on that, what do we do? So we build a mobility manager work plan every year, and this is both approved by our actually approved by our host agencies, approved by the CTD, and also approved by KDOT. So we have individual CTD work. We inform and connect, empathize and advocate, convene and facilitate, design and plan, launch and sustain, and then each of us have our own specific CTD goals. We'll get into some more of these as we go. Go next slide, Dre. Some transportation challenges that we're facing. As many of you already know, we have limited public transit in rural areas. The lack of awareness around available services, that's something that I really work on in my CTD. The gaps in service, funding and resource limitations. We really do know about that one. First, last mile barriers, workforce forced transportation barriers, and then healthcare access challenges. As Mike said, we do different things. Dre said that as well. That's what's great. We can work together and bounce knowledge off of each other. But then in each CTD, those needs are different. Each agencies are different, and regional goals are different as well. And we're here to do whatever it takes.
Yeah, did each of you want to touch base on some of the specific challenges you're facing in your own communities?
Well, one of the big challenges we've faced is driver shortages has been a big challenge. I'm sure many of you faced as well. And then I've been working on this real hard for the last few years, but that getting to the table, being there, what we found out is a lot of the human service agencies or social service agencies, when they're doing studies and things like that, transportation always becomes one of the first or second biggest challenges. And when we're not at the table, quite frankly, we get blamed. And a lot of cases, it's not just the funding and the services we offer. It's also the knowing what is available and having our communities maximize the services that we do offer. Um, got
Sure.
anything?
Yeah, in my CTD or our, I should say, CTD, Dre and I are both in number one. We have a great deal of concentration of healthcare facilities. Uh, I think we're probably the biggest conglomerate of hospitals and providers in the state. We have constant requests to get patients rides, and we also have constant statements from transit providers saying that there's no way they can handle capacity, that they're already past capacity. And so trying to work through projects that can lessen the gap between that and get people where they need to go, get people to their medical trips, get people from our region to the Kansas City metro for medical appointments. These are all things that Dre and I both work on. Um, Probably, I would say at least 20-25% of the day.
Yeah, before this, I actually was on a call with a case manager who was trying to get a patient to a medical appointment down in Ottawa. So that's what I was doing before I pretty much started this call. So it's been one of those days where you just hit the ground running and start pulling strings, calling in favors. So yeah, some unique challenges that I'm also facing is that City of Lawrence is really fortunate to have a robust public transportation system with the Lawrence Transit. But there is still in Kansas and statewide, there is stigma around using public transportation. And there's also some fear and apprehension about using a system that people don't know about. So I devote a lot of time and energy towards travel training and doing community outreach and engagement to get people excited about using the buses and teaching them how to get on and how to navigate the system using, the route guide and using apps, talking to the bus drivers and figuring out how to get around the city. But I do want to reinstate that, like, yeah, one of the biggest challenges I for sure see is that the demand for services is growing, but the financial backing to make that happen is stagnant. So. So all of us engage with the community in different ways, um, but engaging with the community is probably the most vital function of a mobility manager. Like we mentioned earlier, that we serve kind of as a bridge or a connection between the transportation community and all other members of the community. And so these are just the top three ways that I personally engage with the community. So my first probably 9 to 12 months of this job was getting involved with all the movers and shakers of Douglas County. So I was talking to city staff, county staff. I was talking to public health professionals. I met with the Visitors Bureau. I've talked to the Chamber of Commerce. I've done travel training with the Chamber of Commerce. I know like the highest ranking individuals at both of my medical facilities. So I am on a first name basis with like the CEOs there. And so really building up those connections of the people who have the most power and influence, and also joining in on advisory committees and boards. Joining the Community Health Improvement Plan was super amazing and very influential. It got me on in the room and on the seat at the table with, medical professionals of all different facilities in town. I got to meet all the food access individuals in town. I got to meet so many different nonprofits and different service agencies. And, the people attending those meetings are usually like the directors or assistant directors and just high-ranking individuals who are able to help institute lasting change. And so that in itself was pretty amazing for getting integrated into the community. And then, like I said, we all do a lot of travel training. I do a quarterly one with our senior center. We set a date, we post it online, we put it in their newsletter, and then we take, 8 to 10 people onto the bus and we ride, a full loop across town on one of the routes. And we really show them all the nuts and bolts of how to get from point A to point B and how to read through the route guide. But I also do travel training with schools as young as elementary all the way to high school. I've worked with the courts, judicial services, and the reintegration teams and the homeless solutions division. So all these different groups around town that are dealing with different populations. Travel training has really helped me to meet and get integrated into those circles as well. And then it's just about joining public events because, my big thing, as written on here is meet the people where they are. A lot of times people don't realize what they need, or how to ask for what they need, and it's a burden to go out and do that. And so if you go meet them where they're at and you offer them the service at that point, they're more willing to take it. Anything from you two, Mike or Mike?
Well, yeah, and this is somewhere where I do very similar things as Dre in my CTD as well. I was trying to find my numbers. Last year, I did over 300 individual travel trainings, and I'm working with very similar, senior center, um, Be Able, which is our local unhoused day center. Then also, you know, I think is your next slide on food, Dre? I want to make sure I don't
Um,
take too much away from your food
I
access
think
stuff.
food
But
is later on, but
okay. Well, I'll wait for that because that's also something I'm heavily involved in. But then lots of different community councils, and I think that's something I mentioned at the beginning. A lot of transit agencies, specifically the smaller transit agencies, just don't have the resources or the time to really go to all these community meetings, and that's definitely one area where I help out in my CTD. Yeah.
You know.
Ditto. Yeah. And even tomorrow I will be at the K-State open house promoting transportation there. So that's just outreach as well.
perfect. Thanks, guys. And so that really, goes into like how we actually develop our key partnerships and how we work on collaboration. So most of our key partners are going to start off as our transportation agencies that are part of that coordinated transit district. So I've got way more than, Lawrence Transit Senior Resource Center in Independence, and I have way more than that in the CTD. But these three have been the most integral to moving the most amount of people around whenever I call and ask for favors. And these are the agencies that go above and beyond, and they blur their own like boundary rules and will go across county lines at times, and they'll switch their schedules around to be able to squeeze one extra person in every once in a while. Um, and so when I'm working with these different agencies, we're having frequent meetings, we're having informal meetings where we're just going out and grabbing lunch and touching base and seeing how each other is doing on a more personal level. So when it comes to, you know, partnerships and mobility management, it's really about getting to know what the service is, what they can provide, understanding their limitations. And, we all have a shared goal of wanting to help people and we want to move people because whether we realize it or not, transportation is the great connector of all things. Like you need transportation to go to the grocery store, go run your errands, go to the doctor. So we can't necessarily bring the doctor to everybody at all times, but we can move people to the doctor. And so making sure that we're keeping our communities alive, keeping them healthy, making sure people are getting to work. Transportation is just that huge component that, we are always trying to focus on improving. And we always tell ourselves, like, we can't fix everything, but we can move the needle in the right direction. So, anything from Mike or Mike?
Much the same here. I have a different, excuse me, combination of agencies than Dre does. I have a few IDD agencies, intellectual and developmental disabilities. I've got housing, housing the homeless. I've got some family service, um, guidance counseling, and then I've got the traditional senior centers and Topeka Metro, which is Lawrence's counterpart here. Um, they all do a great job. Even the smallest one of them really steps up to the plate when we need them. Um, I've got agencies with two vehicles running rings around other agencies, trying to get people to their medical appointments. They stepped up during COVID, uh, no questions asked, and just really proud of the work that gets done around here.
Yeah, and that just touch on the fostering collaboration piece there. There's like we're saying, and in your communities as well, there's a lot of different things going on. There's a lot of different, between transit agencies and then all the other connections. It becomes kind of where like a lot of us are in our own silos. So I think what a mobility manager can do is we can be involved in all those things and help bring it all together and make sure that at a minimum that transportation is something that is discussed and something that we can work on and move the needle in the right direction, as Dre says.
Thank you.
Okay, so what else can mobility managers do? Innovation and technology. That's something that I just kind of know from my background. Um, there's a lot of things that we have currently that actually not every state has, and sometimes we kind of uh, don't realize that. Reporting wise, with Black Cat, we can help train our agencies on Black Cat use. Communication, we have the Slack, which also is a product that is a KDOT mobility management partnership there that we brought to the state. And then there's a lot of different marketing things we can do. We can work websites, pamphlets or brochures, maps. Dre's really good at the map stuff, the GIS things. Um, and then there's a lot of opportunities out there. I've experienced in these things, and these are kind of potentially emerging technologies for the rural communities. But GTFS real time, and these are some words that we won't get into weeds on all that. But trip planning, which can be done either via app-based or website-based. Camera systems. Our camera systems are becoming a lot more accessible. The costs are going down on those. Microtransit is kind of a big word that people are throwing around a lot. Um, and then AI. I wanted to throw AI in there. That seems scary to a lot of us, I'm sure. But there's really a lot of things that AI can do to help us. And I see that becoming something coming along in public transportation as well. And then dispatching software, this is where I'm going to transition into something that a little plug for Ride Sheet. This is a project that I've been working on for over a year, almost 2 years now. Essentially, it is a simple, low barrier scheduling and reporting tool. So this is essentially technology for a small agency with under 10 vehicles that is low cost, as in almost free, $3,000 a year at the most. We're still figuring those things out. It can bring that scheduling and dispatch to those agencies who may be using like Google Calendar or paper and pencil. And what it does is it collects that data really well, and it helps you give accurate rides as well as data for planning, accurate data for reporting to Black Cat. And it makes the drivers and dispatchers' lives a lot easier. There'll be more on this, and we'll have a session on this at the KPTA conference this fall as well. I didn't want to go too far in the weeds. I could speak about Ride Sheet for a couple hours, but
Oh yeah, we'll move on ahead before
Yes,
we get
please.
going. Let's see. So we all work in our own coordinated transit districts, but we also all work together in a sense. So there are statewide shared projects or regional projects that we all help each other with. And then there are also, individual projects that we might, tap in somebody else for a little bit of assistance on the side. Robin in the Northeast area, she's working on establishing a fixed route and has a lot of questions about the mapping, and that's my strength, and we all have our different strengths. That's one of mine. And so when there's a question about maps and mapping and how do we create this map in a good visual, that's when they reach out to me to tap in and help. And I did a lot of kind of grassroots nonprofit work back when I was still in college, and so that's another area where it's like, how do we go about this in a grassroots way, because we might not necessarily have a lot of funding at hand. And so those are just a couple ways that I can tap in and help other mobility managers. But we do have some statewide initiatives like Kansas Rides website, where we try to keep up to date with all the things that are going on across, public transportation in the state. And we have lots of information on there about public transportation. It links to the RTAP provider page, where you can see all the different public transportation agencies in your area. We are looking at a potential like statewide trip planner at some point. So that's something that we've been looking at. Uh, Spatafor has been really integrated with the National Center for Mobility Management and the National Aging and Disability Transportation Center, NADTC. Yeah,
Good job.
it gets crazy. So he's brought a bunch of grants from those two agencies to help us do some more coordinated transportation between Shawnee County and Douglas County. And I'll let you guys chime in on anything else.
Sure. Yeah, like I'll just follow up on those two things. Working with national organizations that bring money into Kansas, we've been able to do projects that are a little larger than we would be able to handle on our own. And it's been a great collaboration. The mobility managers all step up to the plate. Like I said, every time one of these projects begins, we're all there for each other. Gray had mentioned Robin's project for a transit route. He's working on the mapping. I've met with her because I have a history of projects like that, and I gave her some advice on who to contact. And then I know Michelle Coates actually set up a program much like that in her region. So I recommended the two of them talking a great deal to go through logistics of things like, how to meet up with the organizations, how to decide where the stops are, et cetera. So, as was said earlier, we do try and help each other out however we can. But yeah, the collaborative efforts that happen here in Kansas kind of actually got us noticed on the national stage. And so a lot of us go to conferences, not just to go to, but actually be presenters at those conferences talking about what we're working on, which is sometimes cutting edge.
Yeah, and then Michelle, she's very organized and very involved in countless organizations and everything. But one of her other strengths is that she's really good at putting together um, visuals and presentations, and she put this presentation together. So that was really beneficial and stuff because all three of us are working on presenting, but it's really good to have one person who's like that main person to get the ball started on this.
Yeah, and I can touch on a little bit. You mentioned being noticed nationally. I think we were just at our first Association of Mobility Management conference this last weekend, and it was the first inaugural. Uh, and one thing I really did notice is we are, even though it feels like some days we're just figuring it out, we are actually way further along than other states. And I'm really proud of Kansas Mobility Management, how far we've come, all the way from when essentially Mike hired me when he was the transit manager there at KDOT. And I just noticed like we really have a lot of knowledge and experience, and we're essentially leaders, not just, in our CTDs and nationwide. People are coming to us with questions and looking at us with advice. That's not saying we don't, there's still not a lot to learn, but I was really impressed with that.
Yeah, somebody from I believe somewhere in Minnesota actually reached out to me a couple months ago, and he was really interested in Lawrence's travel training program and how I do it and everything that I present and all the nuance within that. And so I sent him over all my materials, and we had a meeting online, and we talked for about a half an hour and everything. And now he's working towards developing a trans travel training program up north. So.
Yep, great.
We do have some other shared projects that Mike is going to get into,
Yeah,
but I think a
and
lot of us we're
we have
gonna,
about 7 minutes, so we'll kind of go through that
yeah,
quickly.
okay.
Um, So, if you haven't heard yet, we have Kansas Mobility Week. That usually is that first week of November. It's based in Florida. I didn't even know that. I thought we
Yeah,
started
we
it.
stole it.
We stole it.
We stole it and we made it even better. Just so you know, last year we had 61 events, 38 counties. So, I think this has been a great thing that we do every year annually, and we'll continue to grow on that. Next slide. What else we got here? Oh, Kansas Bike Month. That's May. That's coming up. That's been something. This has kind of been more of a Michelle project, but we all participate in it as well. Next slide. Maybe move. Oh, National Transportation Week, also in May. Uh, Something where you can, I should see, have a cookout, appreciate your drivers. Um, Next
Get people
slide.
to ride the bus for the first time.
Yep. Convince your, See if you can get your commissioners to ride the bus. That's always a good thing to do. Moving Kansas Network. This is something we put together so we can come out of our silos. So specifically, the larger agencies can communicate and we can learn from each other. Next slide.
Um, Let's see. We'll talk about food access kind of briefly.
Sure.
We're all involved in, healthcare access, food access, et cetera. And so this is just to point out different ways of how we are tackling the food access and food security issues within our communities. Like I said, I was part of that community health improvement plan, and that was divided up into 6 or 8 subcommittees, one of which was food access. And so I sat on that subcommittee as well as the healthcare access subcommittee. On this food access committee, I worked with Harvesters and Just Food. Just Food is a local food pantry, and Harvesters is that more regional, national food distributor. And we came up with a whole section of this community health improvement plan on how we plan on addressing food security within the Douglas County region. And we've started implementing some of that work already, and we are doing twice a month food distribution from our main bus hub now. So instead of people having to go out and get food, bus riders on their evening commutes from 3 to 5 p.m., they can swing by the bus hub on the second and third Thursday of every month and get free food and groceries. Mike's?
Well, I'm also heavily involved both in specifically Riley and Gary County Food and Farm Councils. I was actually the Blessing Box coordinator, which is kind of a pantry that, if you're familiar with them, it's give what you can and take what you need type of thing. And I was involved in getting 6 new boxes installed here in Riley County, and specifically trying to get them near bus stops. Um, what else? Food insecurity. I'm on the food insecurity cat. So just being involved, and it's not always tied to transportation, but I try my best. If they're working on community gardens, well, where's the nearest stop? How do we get people to those gardens? Just a simple example.
Sure. And then I've got some obviously slightly different ones. The agency I work at, my host agency, is in charge of farmers market coupon distribution for seniors and people with disabilities. So I always help processing those paperwork. It sounds like a small event, but it's actually a day-long thing that requires about 12 staff people to orchestrate the whole thing. I help with the CHAMPS program, which is a senior eating program that has sites around Topeka that people can go and get an affordable meal that's prepared and healthy, and they have options about where they would like to go and spend that money. And then there's also the food distribution from harvesters, which Dre also works with. We did, especially during COVID, a lot of us went out with our own cars and did box distribution when congregate sites weren't necessarily providing the food that people needed. So, yeah, there's a long list of the potential variety programs that we work with that help people get access to nutritional products.
And just to give a nod to Michelle, so there's a lot of food insecurity in the Salina region, and she worked with me and I think Mike Wilson a lot and talked to my food policy council and read through our documents. And through that work, she was able to get enough people together who were passionate about this to develop their own food policy council called the Food Action Community Team. So they have a new organization there that's working to work on food insecurity in the Salina region, which is pretty awesome. And then that's all that we have for you guys today. We're here to take some
I've got a
questions.
question to ask Dre for all of us.
Yes.
What has been the most rewarding for of being a Kansas mobility manager? What
Ooh.
has been the most rewarding?
The most rewarding thing for me is honestly knowing that I have been able to move that needle. I have seen the impacts of my work positively impact some people's lives. So I think that would probably be the most rewarding thing because like I know I can't save the world, I can't save everybody, but I know I can help out as many people as I possibly can. So I think that probably was is the most rewarding thing for me.
Yeah, and for me, I just have a passion for helping people. I think when you make that difference in just even one person's life, and we know in transit that that's what we do, that's the most rewarding thing for me. Uh, I just give a quick story. Um, had an individual just the other day where he had, long story short, he needed to get to dialysis. He was unhoused and he does not speak English. So had a difficult time getting him to the right stop, knowing where he didn't really know where we didn't know where to pick him up. So I actually went there and during his pickup window we could not find him. So I had to just get in my personal vehicle and just look and kind of in a quick moment where I was just driving around like if he doesn't get to dialysis he might lose his seat and then he might lose his life. So I actually found him about a mile and a half away and he was walking with a crutch. He had just had his like some toes amputated or something like that, and there was no way he was going to make it. So I said, just jump, just waved him in, jump on him, and I drove him there. And then from there, we just continuously worked with him to figure out where a good drop-off point is, and now he is using dialysis 3 times a week. So I think just simple stories like that, like we're making a difference in people's lives. So.
Metaphor.
What's your most rewarding thing, Mike?
I'd have to say, um, I had a client once call me. She had moved from the house that she grew up in here in Topeka and was now in a senior assisted living apartment building. And she didn't know the neighborhood at all. And she wanted assistance about figuring out a way to walk um, so that she could get some exercise every day. And I was like, well, this is interesting. So jumped on it and called her up, found out that she is completely blind. And that was a huge component of her day was walking around her neighborhood like 2, 3 times a day, get fresh air and exercise. So I went online and Google was wonderful, helping me map out a route for her. So we did a half mile and a mile route. And then I went and trained her every week for about 2 months. We would walk the route together and discuss any kind of landmarks or things that would help her. And yeah, at one point, it's sad, but you get the email saying, I got it. Thanks. I don't need you to come anymore, but I'm grateful. And that was a really eye-opening situation for me because I had never done that kind of training before. So travel training takes on a lot of different facets.
You have any more questions for us, Mike?
Nope, I was just reading off a question from our RTAP friends. I think
Oh,
that was from Nikila. So we'll pass it back to Beth.
Yeah, thank you all for that presentation. That was really great. We'll go ahead and open it up for any questions from anyone in the audience. You can feel free to just unmute yourself and ask, or if you'd prefer to just put it in the chat, I can read it off for you.
I have to say, I think we've also done a really good job uh, putting out to the state what mobility management is, and that's probably why we don't have a ton of people on today. That's what I'm going to say. I know Mike and I, especially, we've gone to multiple CTD meetings to present our
Yeah.
M&M presentation, where we bring M&Ms as well, and uh, now that CTD even has a mobility manager. So
Yeah.
we're still looking for a few more, though, I think.
I was going to say, is there a way we can get a list perhaps of the mobility managers in their regions and the areas that aren't currently covered?
Yeah, I think Dre had that on his slide.
Yeah, and I'll
What?
post a link in the chat in just a moment. Let me pull something up,
Thank you.
but you guys can carry on while I pull this up.
So hello, Phil. What CTD are you from, or what agency?
I'm actually with Beyond Barriers, but I work with Ford County LHEAT, which is the local health equity action team. And we've been very interested in transportation for folks with primarily medical needs, but also looking at a triangle between Dodge City, Garden City, and the city of Liberal.
Wonderful.
Southwest.
Bill,
Yep.
I posted that in
Southwest.
the chat, and actually, I think you and I should have a conversation at some point. I was working with Abigail a couple months back, trying to convince your CTD to get a mobility manager. Um, didn't quite get them convinced, so if you'd like to have a chat at any point, Phil, let me know.
That would be great. Thank you.
Thank you.
And we didn't kind of go too far into the cost, like what does it cost to have a mobility manager? Well, uh, shout out to KDOT. We are 100% funded, so there is no cost directly to the CTD. Um, we are 100% reimbursed by KDOT, and maybe Mike, stop me if I'm saying anything wrong, Mike. Um, but we are housed at a host agency, but we do cover the entire CTD. Um,
Yeah, we actually, to go a little bit deeper in that, as you said, 100% KDOT reimbursement funding, so the agency doesn't have to pay to have us there. We are grateful for the space, and in exchange for their gratuity, the agency is allowed to charge us rent. So it's not like they're doing it out of the goodness of their heart. There's also a monetary compensation for it. But again, that's part of the 100% reimbursement rate from KDOT that we're very generously using. So yeah, it's really all about getting the agencies together, getting the CTD providers together, and coming up with a plan for how they could use a mobility manager for their specific needs and goals. Because as we said in the beginning of this presentation, like we're all doing slightly different jobs. And I guarantee you that the needs of your area down in Southwest Kansas are going to be very different from what I deal with here in Topeka. So I'd encourage you and Dre to have that conversation and work forward.
Yes, and you do not need unanimous consent from the CTD to get a mobility manager. So technically, you just need one person who says, I want it, and then they apply, but it does help to have a couple agencies on board.
and not everyone will be like accepting of a mobility manager at first. But just to clarify, we're not here to be like a whistleblower, or we're not here to make your lives difficult in any way. I had an agency when I first started. They literally told me like they said, don't, what they say, don't call us. We'll call you. It's not like a breakup or something. And I was like, what did I do? I didn't even do anything. And they just were very afraid of change. They thought I was going to go in there and just, flip everything over. And no, uh, that's not what we do. We're here to help in whatever way that is needed. Fast forward, that agency actually won KPT agent. They were like Kansas Transit Agency of the Year, and they won the Technology Innovation Award as well. So it just took a little bit, and they did a full 180. They did from what they have about 400 rides a month, and now they're doing close to 1,000 rides a month. So, so there was some change that I feel like I was really helpful with there.
I have a question if no one else does. So I'm curious what trends or developments you all see shaping the future of mobility management in Kansas.
That's a kind of a tricky one because there's a lot of different trends going on right now.
Mhm.
So you have the trend of people from wealthier states moving to rural areas and then aging in those areas. And then as we age, we give up our keys. And so you see people going into these rural areas, but then you also see a lot of people leaving those rural areas. So it's kind of like a weird fluctuation of people who do and do not need it. But also,
Mm.
there's massive service gaps in rural areas, and we see that the rural areas are getting smaller and the urban areas are getting larger. And so it's the people who are left in those rural areas are getting older, generally speaking. And so the individuals who need this kind of service in those areas is getting bigger, but the amount of people who are wanting to or interested in driving and working in these areas is not getting any bigger.
I'd have to say I would go with transportation to dialysis. Um,
Mm.
it's already happening, but it's such a jigsaw puzzle of moving parts that it's something that's going to have to be focused on a little more. Um, Two parts. Um, the the patients need to get to their treatments, and it's usually 3 times a week. Um, Having an agency that is available when the patient finds out they need to go, having an agency that's available to make that trip can sometimes be difficult for two reasons. One, sometimes the agency isn't as agile as you would like it to be, and they either are over excuse me, over subscribed with riders already.
Mhm.
Or B, we've had more than once happen in Kansas. People are going to dialysis and then they find out that suddenly their center is closing. And
Mm.
now the 20-minute trip is a 3-hour trip to the next available dialysis center. And so
Mhm.
I think um, adaptation is going to be huge, especially with medical trips. Being able to switch gears, being able to be flexible, which ironically is usually something that falls to the smaller agencies, the 5310s and 11s, and um, because they have that ability to make changes quickly and they're not beholden by any great um, policy and procedure manual that's 5 inches thick. Um, so I just think that, yeah, adaptation to changing needs is going to be huge to get Kansans where they need to go.
Yeah, I'm definitely seeing that as well. From a technology standpoint, I mentioned a little bit on like the AI stuff, but really, our the boomers are becoming our riders, so we're seeing increased need. We're not seeing the increased funding, so that becomes a trend, a development. But from a technology standpoint, what one thing I say, my grandma has a smartphone now. So I'm not saying everybody is able to use a smartphone, but we're seeing that more and more. A lot of my travel training becomes, oh, I can pay for the fare from my phone, and it's really this easy. Or even like, people want to be able to track their rides. They want to be able to see where the bus is. And then the next trend, people want to be able to call for rides without calling anyone too. So, and that's not everyone, but that's a trend. Kind of this Uber Lyft society. That would be that micro transit angle. So, um, and definitely, it's time to get away from paper pencil tracking your rides and trips. It's just not ideal. It's not good for data, not good for reporting. It's not good for uh, uh, planning for the future, your 5-year plan, etc. So I think that's a big thing. So ride sheet.
All right. Well, we're approaching time, so I just wanted to say thank you all again for presenting. It was very informative and a lot of good information to hear. Just so everyone knows, we are recording this webinar and it will be posted on our YouTube channel. I just put the link for our channel in the chat box, so please feel free to check that out and check out our past webinars, which were recorded and uploaded there as well. But thank you all for attending. We really appreciate it.
Thank you.
Having
And
us
You guys.
thanks, Mike. Great.
welcome.
Thanks. Good to see everyone.
Thank you. Reach out, Phil.
For sure. Yeah.
All right, bye-bye.